What happened in Ballari is extremely sad. I mean, there are no two ways about it. I have had several discussions on the ringer lactate, which is mandatory apparently for women who have to undergo C-section, so that it hydrates you, because you are not allowed to drink water or eat anything for the 24 hours. But the point is, just to put the blame on private hospitals, and also to put the blame just because I am rich, I am getting a caesarean done, is, I think, very, very unfair. Dr. Gajraj, I know journalists shouldn't do it, but here I am going to raise my hand, 2 caesareans, and only because I cannot give birth normally, naturally. And therefore, there was no option but to cut me up. It is not something that I chose, doctor. It was something that my obstetrician told me, this is the only way that we save you and the child. So, what is with this? You have incentives and therefore you do C-sections. I think this is a misnomer.
I, I think it's not just what you think, it is definitely a myth. There's no doubt about it. There's a lot of change in the scenario over the years. Now, when I started practice, say 35, 40 years ago, the number of high risk cases was very, very much less. Now we have a number of pregnancies are complicated with diabetes, hypertension, big babies, or growth restricted babies. There are a number of complications pregnancy related that we are seeing, which might necessitate an elective cesarean section. So that's on the one side. Secondly, there are certain indicated cases. Now, for example, a previous cesarean invariably does go in for a repeat cesarean section, and we need to correct these rates that are being given to us, eliminating the elective repeat cesarean sections. So, if we are talking of primary sections, it's usually when somebody has a residual poliomyelitis or what we call a placenta previa, where the placenta is completely covering the os. We have no other option to go for a cesarean section. Now, breech, when the baby is upside down, when the head is not coming down first, is optional. There are some obstetricians who would do a cesarean, some who would go for a elective section, and that debate has been going on for a long time. Now, other cases, the indication would purely be because if the control of the medical condition is not satisfactory, or the woman has gone post-dated and she's not responding to any induction, or because in labor she's not progressing, or there are changes in the baby's heart rate. So these are the only indications.
Yeah.
Every other woman is allowed to labor and go in for a normal delivery.
Right. You know what really, Dr. Gajraj, because of these deaths in Ballari, which are very unfortunate, the ringer lactate was obviously, it has been found to be faulty, found to be, not usable. And of course, the pharma company has been blacklisted, etc., etc. Because there was a mistake done in Ballari, you can't possibly park the mistake on the feet of all caesarean sections, and for the minister to say, because there are incentives. At my time also, caesarean was much more expensive than normal delivery. But it is not that because one is well off or looks privileged, one goes for this. There is distress, there are several other reasons, and in a way, I would rather trust you. My doctor, I know that you are here to save my life and my baby's life. Why would you cut me up? You don't have to cut me up at all. A normal delivery is what it's easy for you, it's easy for me, it's easy. Now, also for the doctor to say that it is not safe either for the mother or the child, myth, I think.
Absolutely, I think you've just hit the nail on the head. There is no need, because if we are going for a cesarean, the post-operative complications can be much, much more. So any day a doctor would prefer a normal vaginal delivery or an assisted vaginal delivery. Now, in the institution where I work, we actually have charged the same fee irrespective of whether it's a cesarean or a normal delivery. And it is not a high fee. So people understand that we give equal time and we wait for a normal delivery. And if it's not possible, only we go for a section, not for the financial incentive. And I can touch my heart and say I'm speaking on behalf of all the obstetricians when I say this. No, I don't think any doctor would do it for the monetary benefit alone. And that's absolutely a myth and not.
Dr. Gajraj, also there is indication in what he has said is as if the government hospitals don't do caesareans. I know that there is also an allegation that private doctors do not wait. Whereas government hospitals, a woman is supposed to push for 24 to 36 hours. Isn't that very, very traumatic and dangerous for an expectant mother to keep pushing? I mean, it's not a joke, is it? Tell me from the medical point of view, Dr. Gajraj, don't government hospitals perform cesareans? It's impossible for them not to do it, ma'am.
Definitely. In fact, the government hospitals become a referral center. They become a referral center for high risk pregnancies. So the section rate there is also high. It is not low. It is comparative to what the rate is in the private practice. So it is not true to say that government hospitals it is less and in private it's more. The threshold may be for a woman who comes to a private hospital for opting for a section after being in labor, maybe a little more. That is true, that we cannot deny that. But certainly there is no big difference because the government hospitals are referral centers and they get all the high risk cases. So they are also forced to do cesarean sections. And there is no big significant difference in the cesarean section rates between the private and the government. I agree with everybody that it is good for all of us to keep it as low as possible. There's no doubt at all about it. But where indicated, we cannot compromise a woman's health just because we want a normal delivery or just because we want the rates to be low.
Yeah, because a lot of times C-sections are also associated with celebrities who do not want to undergo the pain, etc. I do not know how true that is, Dr. Gajraj. I will not ever kind of just do a generalization which is so sweeping. I mean, it is all hearsay, what people hear, and word of mouth they spread it. I want to ask you something, because it happened in Ballari, which is not urban Bengaluru, Chennai,
Yeah.
Kolkata, Mumbai or Delhi. Therefore, the big question is, because of these tragedies which occurred there, Dr. Gajraj, not one, 5 deaths. A woman, the last woman to die there, all of them apparently were in excellent health. They were all young, as in, age is also very, very important when it comes to delivering a child in a healthy, normal fashion. But the thing is, because of this ring lactate, this kind of this thing which failed, the question is, how come
Yeah.
in Ballari there are so many women who opted for caesarean? It is not possible at all. Please explode this myth for us. The rural-urban divide, hasn't that also, there has been a major change in the expectant mothers now?
Certainly, expectations have changed and are changing over the years because they are also exposed to the same, internet media, etc., in their own lingo. So they are also reading about it. Enough media is thrown at them, so they know what to ask for. But what we have to understand is that these women are not saying, come, walking in and saying, do a cesarean for me. They are indicated cesarean sections. More and more women, especially in South India, you will find are coming to the hospitals for delivery.
Oh.
And because they're not having deliveries at home, medical help is available to everybody. So any government hospital, any small health center also is equipped to take care of deliveries and pregnancies. So the care given is definitely there, and people are coming in for help. So we cannot say just because it's Bellary, they should have had more normal deliveries. Women are the same, indications remain the same. Facilities may change from one center to another, but that will not make a major impact on the overall cesarean section rate. I think where we should be concentrating is why did we have substandard IV fluids?
Yeah.
Did we have IV fluids with contamination? That is more important to address.
Absolutely,
See,
you hit
because the
the nail
same
on the
IV
head.
fluids,
Yes, you
yeah,
hit.
the same IV fluids will be given for a woman going for a gynec surgery.